Hello everyone, welcome back to my YouTube channel once again. So today I'm going to discuss about the most important topic called impaction and classification and management and complication. What will be happening, like complications, like if you do anything complication, so how to manage it, I'll be deeply discussing in this video. Okay, so let's begin this journey without wasting the time. Okay, so you can, by this picture you can realize what how the impactions look like, impacted tooth look like. Okay, so in x-ray you can see how the impacted tooth is in the bone level. Okay, so next, what is the definition of impaction? It's majorly about the causation of the eruption of tooth caused by physical barrier or atropic positioning of the tooth. It might be physical barrier or any atropic position of the tooth. Okay, so see, this is how the it look like. Okay, see the four tooth, how the third molars are intact in the bone, and physical barrier how it is there. Okay, so next, here also you can see how in the bone level how is tilted. Okay, and causing other tooth also damage. Okay, so it is very necessary or very important when it getting erupted on not positioning properly, then you have to go for the extraction of this tooth also. Okay, so next, classification. So winter classified this third molar extraction or impaction. Okay, first is angulation: mesoangular, horizontal, vertical, and distoangular. Okay, so horizontal, you can see how the tooth has been horizontally placed and partial erupted, matlab half of that little bit crown portion will be seen. Okay, vertical, it will be like proper, but it is not been able to erupt due to the other tooth. Okay, so distoangular, like distal side, it will be tilted. Okay, periodontal diseases, like if any pericoronitis you can see in this form. Okay, orthodontic crowding, it forms the like orthodontic crowding, like the third molar while erupting, it will cause the pressure on the other teeth, so it pushes the other teeth and malfunctioning, like misalignment of the tooth you can see due to the third molar eruption. Okay, so here also you can see clearly how mesial impaction look like: vertical impaction, distal impaction, horizontal impaction. Okay, so based on type of overlying tissues, like soft tissue impaction. Okay, partially bony impaction, complete bony impaction. Okay, so next, he classified by position or depth. Okay, position A, above the occlusal surface of the third molar. Okay, position B, how it will be looking like, above vertical level of second molar. Okay, third position C, below cervical level of the second molar. So this is according to the depth. Now we are coming to the ramus relationship classification, like class 1, sufficient space will be present. Class 2, space is less than mesodistal width of the molar. Okay, class 3 will be third molar embedded in the bone, it will be inside the bone itself. Okay, so now how you will be doing the procedure, I'll be explaining you detailedly. Okay, steps in impaction. Okay, isolation. First you will isolate the tooth, like you will clean the tooth with the chlorhexidine gluconate 7.5% for the skin and 0.2% for the mouth, for mouth rinse. Okay, then you will ask and you will drape the patient, then you will anesthetize the area, like pterygomandibular nerve block you will be giving. Okay, so after anesthesia you will be waiting for around 2 to 3 minutes so that the leg come into action. Okay, then you will put the incisions are different type. Okay, short envelope flap. Okay, here incision start from middle of the distal aspect of the second molar, and the second molar distal incisal. Okay, so incision along the margins of the second molar cervical incision. Okay, so this is how the look like. Okay, so we'll start the incision. Okay, from the middle of the distal molar. Okay, so next will be, for different cases different you can give. Okay, for long envelope flap, for deeper impactions. Okay, distal incision is similar, cervical incision is extended up to the mesobuccal line angle of first molar. Okay, so this is how the long envelope flap look like. Okay, so next is third triangular envelope. It is an envelope flap with vertical relieving incisions. Okay, there will be two vertical relieving incisions. Okay, distal incision is similar, vertically relieving. Okay, incision starts from distobuccal line angle. Okay, incision will be starting from distobuccal line angle up to the distobuccal cusp of the second molar. Okay, next, distal and relieving incision are connected through cervical incisions. Okay, so this is how it look like. Okay, next is uh, reflection of the flap. You will reflect the flap. Okay, next what you will do after the incision of the this one, then you will go for the reflection of the flap. Then after that, bone removal. If any bone is present, how you will remove it? Either there are two methods. Okay, one is chisel and mallet and burr technique. These are the two methods. You can follow any one, whichever you feel easy. Swiping the burr occlusally and buccal and distal aspect. Okay, buccal thought is created. One buccal pit is created, then bone is removed, and the chisel and mallet is vertical stop distal given. Okay, to the second molar. At the base of it, oblique cut is given distally. Okay, triangular piece of bone is removed. A triangular piece you have to remove. Okay, then this is how the chisel and mallet vertical stop cut you will give. Okay, so this is how you can see in the diagram how we are giving the removing the impacted lower third molar by chisel and mallet. Okay, so next is, after that, if the crown is too deep, then you will tooth section will be given. Crown is removed just above the cervical line, then the crown will be removed just above the cervical line. Root are sectioned and removed. Okay, we'll cut the tooth into two halves. Okay, then you will remove one by one. Okay, this is how you are going to distal sectioning of distal part of the tooth. Okay, next, this is in this method also you can see, first you will give horizontal place lower third molar, sectioning of the mesioangular place placed lower third molar, then sectioning of the vertical place third molar, then sectioning of the distoangular place lower third molar. Okay, next you will elevation. Okay, elevator is placed at the base of the crown and elevate it. You will just place the elevator instrument near the crown and you will just try to elevate the tooth. Okay, then debridement and debridmentation. Okay, so here, like, irrigate the socket, then after removing the crown, then you will irrigate the socket. Okay, control the bleeding, then you put the suturing. Okay, and give you will give the suture. Okay, and you will recall after 7 days to check. Okay, what are the complications you can go in this, like during incision, in nerve injury to the vessels you can see. Then during bone removal, damage to the second molar or root. Okay, slip of the burr. If the blur is slipped, then it is like fracture of the mandible. During luxation, while you are elevation, like you may fracture the bone or tuberosity, or split the bone into the spaces. Okay, damage nerve. Okay, so during debridement, damage to the nerve. Okay, or damage to the sinus, you can do it. Okay, like so you should be very careful when you are doing the third molar extraction. Okay, then post operative pain, swelling, trismus. Okay, sensitivity, you all this all will be seen. Okay, this is all about the impaction. Okay, this is one of the most important asked question, so be prepared properly, and while doing extraction also be careful when you are handling the patient.